Because our oldest is almost 17, we were thinking about getting our tubes tied. My tubes tied. He doesn't want to.
Okay, so we have to back up in there.
He could get his tubes tied.
Exactly, because I speak to my patients when they come back for their 2 and their 6-week appointment, and I always say, if the question comes up that you feel like you're finished, and I don't know, she's so beautiful, you really want to be finished? But anyway, it's much, much easier for the dad, and I say to the moms, first thing you could do, if you've had, you went all through that for the babies, the least you can do is do the tube time. And it's so much easier, and I'll tell you why.
It is easier.
Yeah.
I mean, I got it done. It's really not that big of a deal.
It's an office procedure, right?
Office procedure. You take the weekend off, you sit on the couch with some ice there and watch some movies, and, it's a nice little 2-day vacation.
Whereas for the woman, and there are some options now I will mention as well, for the woman, it's really, as it is for a man, a permanent procedure. You have to consider that it's not reversible when you're doing. We actually make you sign what we call tubal ligation papers. You have to actually sign them 30 days before we can actually do the procedure to make sure you're sure, because it's not meant to be reversible. The tubes are the passageway for the sperm and the egg, and that's how conception happens, right? The sperm and the egg meet together up in the tube. But if you cut the tubes, so we call it a bilateral tubal ligation because you do this on both sides of the tubes, you cut them, you tie them, you cut them, and then you burn them. And that keeps the passageway, again, from the sperm and the egg from coming together so they can't meet, so that's how it's sterilized. Now, if you want a reversal, then what we do is something called a tubal reanastomosis, meaning putting them back together. But the likelihood of this actually being effective is very minimal, and so you really have to think of it permanent. Again, this is under general anesthesia. It's a surgical procedure. You do it in an operating room. So much more invasive and so much more recovery than getting your tubes tied in. Isn't it your turn now?
Yeah, I think so, maybe.
You can see which patient I favor.
Absolutely.
So we're so happy, and again, I want you to think about it because you make some beautiful babies.
Oh, thank you.
So we've got a special present for you, Tamika.
Ooh, look at that.
Yes.
Some good stuff.
Okay.